Welcome to our medical assistant practice test. This test consists of 100 questions designed to help you prepare for your medical assistant certification exam. Each question includes an explanation of the correct answer, so you can understand the reasoning behind it. Whether you're just starting out in your medical assistant career or you're looking to refresh your knowledge, this practice test is a great way to get a feel for the types of questions you can expect on the actual exam. Let's get started. 1. A deductible, A, is paid by the insurance company in full. B, is deducted from the payment owed to the physician. C, is paid by the patient before insurance coverage pays for medical costs. D, is money owed to the insurance company. Correct answer, C, is paid by the patient before insurance coverage pays for medical costs. Deductibles are set amounts of fees that will be the responsibility of the patient and are not covered by insurance. These fees usually have a limit, and once that limit is reached, the insurance will then cover the difference. 2. A document from an insurance carrier that tells the patient and the provider how the amount of the benefit was determined is the underscore. A. Utilization review. B. Basic medical. C. Explanation of benefits, OB. D. Peer review. Correct answer, C. Explanation of benefits, OB. The explanation of benefits, or EOB, is sent to the patient and to the provider, detailing how the benefit was determined based on the patient's particular healthcare plan. 3. Your patient has Medicare and a type of Medigap insurance. Where should you send the insurance claim when you file her insurance claim? A. The claim must be filed with Medicare first. B. The claim must be filed with the Medigap insurance carrier first. C. The claim must be filed with both insurance carriers at the same time. D. A claim does not have to be filed. Payments from each policy will be automatic. Correct answer, the claim must be filed with Medicare first. A Medigap policy supplements regular Medicare. These often pay for deductibles, coinsurance, and for services not covered by Medicare in some cases. Medicare is still the primary payer, and you file with Medicare first. 4. What term is used when an insurance company makes a payment directly to a physician? A. Direct deposit. B. Fee compliance. C. Assignment of benefits. D. Actual charges. Correct answer, C. Assignment of benefits. The authorization to make payments directly to a physician by the insurance company is called an assignment of benefits. The patient has authorized his or her insurance company to pay the benefit to the physician. 5. All of the following are types of insurance plans, except EPO. B. HMO. C. PPO. D. U. Correct answer, D. U. Exclusive Provider Organization, EPO, Preferred Provider Organization, PPO, and Health Maintenance Organization, HMO, are types of insurance plans. Who is not a type of insurance plan? WHO refers to the World Health Organization. 6. Which of the following is an insurance plan for military personnel and veterans? A. TRICARE. B. HMO. C. PPO. D. EPO. Correct answer, A. TRICARE. Insurance plans for the armed services include TRICARE and CHAMFA. TRICARE is a comprehensive health benefit program for the dependents of men and women of the armed forces. 7. What is the annual amount an insured must pay toward the cost of medical services before insurance policy benefits will begin covering medical costs? A. Copayment. B. Deductible. C. Fee for service. D. Coinsurance. Correct answer, B. Deductible. A deductible is an annual amount to be paid by the insured toward the cost of service before the insurance policy benefits are started. 8. Which of the following are documents prepared by the insurance carrier that identifies the services covered by the policy, the amount billed by the provider, the amount paid by the insurance carrier, and the amount for which the insured is responsible? A. Certificate of coverage. B. Contingent beneficiary. C. Explanation of benefits. D. Coordination of benefits. Correct answer: C. Explanation of benefits. The explanation of benefits explains the following to the patient: the services covered by the policy, the amount billed by the provider, the amount paid by the insurance carrier, and the amount for which the insured is responsible. 9. Cash amounts that are paid out are called A. Payables. B. Disbursements. C. Invoices. D. Packing slips. Correct answer: B. Disbursements. Disbursements are the payment of funds and can be cash or check or even by office credit card for these purposes. Disbursements can be entered into the accounting record several ways, and this would depend on the accounting system in use in each particular office. 10. Amounts that are owed to a business for services rendered or goods supplied are called A. Liabilities. B. Accounts receivable. C. Vendor requisitions. D. Disbursements. Correct answer: B. Accounts receivable. In the accounting system, the accounts receivable would be termed as the sum that would be owed to the business. The bookkeeper/accountant would keep a balance of what is owed and should be collected in the future to the business, such as a medical clinic. Adjustments can be made in some circumstances by the accounting department. 11. If a patient is choking and cannot speak or breathe, what should be done? A. Give the patient water to push the obstruction. B. Give chest compressions. C. Do the Heimlich maneuver. D. Begin CPR. Correct answer: C. Do the Heimlich maneuver. If the patient cannot speak, cough, or breathe, performing the Heimlich maneuver is the next best step. If the person is sitting or standing, stand behind him or her. Form a fist with one hand and place your fist, thumb side in, just below the person's rib cage in the front. Grab your fist with your other hand. Give quick inward and upward thrusts. 12. If a patient complains of dizziness and is about to faint, what steps should be taken? A. Ask the patient stand and do light exercise. B. Give the patient soda or sugary drink. C. Sit the patient with the head lower than the heart. D. Do chest compressions. Correct answer: C. Sit the patient with the head lower than the heart. The next best step is to sit the patient with the head lower than the heart, loosen the patient's clothing, apply a cool cloth to the head and pass ammonium salts under the nose. 13. Which of the following is not recommended when assessing emergency cases? A. Call 911. B. Use the ABC method to assess the patient. C. Move the patient and transfer to a chair or bed. D. Look for alert tags. Correct answer: C. Move the patient and transfer to a chair or bed. In evaluating emergency cases, unless the patient is in harm's way, do not move the patient. The patient can have a spinal cord injury, and moving the patient can inflict more damage to the patient. 14. Which of the following medications is used for anaphylaxis? A. Adenosine. B. Epinephrine. C. Lasix. D. Narcan. Correct answer: B. Epinephrine. Epinephrine is the medication of choice in the first aid treatment of anaphylaxis. Epinephrine reverses the effects of anaphylaxis on the heart, lungs, skin, and skeletal muscles. 15. A 45-year-old male was brought to the clinic because of chest pain. The patient has a history of hypertension and heart disease. Which medication should the patient take to relieve his chest pain? A. Nitroglycerin. B. Adrenaline. C. Insulin. D. Advil. Correct answer: A. Nitroglycerin. Nitroglycerin is used to treat angina pectoris in patients who have coronary artery disease. Nitroglycerin is a vasodilator. It works by relaxing the blood vessels so that more blood and oxygen can flow through the heart. 16. A 7-year-old boy tripped and fell with an outstretched arm. This injury would most likely result in A_. It calls fracture. B. Spiral fracture. C. Greenstick fracture. D. Rickets. Correct answer: A. Calls fracture. The most common cause of a Calls fracture or distal radius fracture is a fall onto an outstretched arm. A fracture of the distal radius happens when the area of the radius near the wrist breaks. 17. A patient came in with a big piece of her skin and soft tissues still hanging like a flap. This wound injury is referred to as A_. A. Contusion. B. Laceration. C. Abrasion. D. Avulsion. Correct answer: D. Avulsion. An avulsion is a serious soft tissue injury. It occurs when a section of the soft tissue is partially torn away, leaving a flap of skin hanging from the body. 18. Cold and heat modalities can be applied to A. Reduce inflammation and break the pain cycle. B. Improve circulation. C. Decrease muscle spasms. D. All of the above. Correct answer: D. All of the above. Cold and heat modalities help in reducing inflammation and swelling and breaking the pain cycle. They can also decrease muscle spasms and improve circulation. 19. All of the following statements regarding vital signs are true, except vital signs give essential information that guide the health provider. B. Estimation of vital signs is always allowed. C. Vital signs can indicate if a patient has a disease. D. Vital signs are also called the cardinal signs. Correct answer: B. Estimation of vital signs is always allowed. Vital signs are objective findings. Accurate reporting of readings are a must in vital signs. The medical assistant should avoid estimation of the readings because treatment of patients rely on these vital signs. 20. When taking a patient's pulse, the most commonly used artery is A. Apical. B. Radial. C. Carotid. D. Axillary. Correct answer: B. Radial. The radial artery is found in the groove on the thumb side of the inner wrist. This is the most commonly used side and very easily accessible. 21. A 15-year-old boy complained of a sore throat. After testing the patient, the results revealed a strep throat. What is the shape of the bacteria? A. Rod-shaped. B. Round in clusters. C. Round in pairs. D. Round in chains. Correct answer: D. Round in chains. Streptococci are bacteria that are seen in the microscope as round or arranged in chains. It is also classified as gram-positive bacteria. 22. A patient was brought to the clinic because of fever and jaundice. The doctor's impression was hepatitis A. What is the mode of transmission of this virus? A. Oral, fecal. B. Sex. C. Blood. D. Direct touching. Correct answer: A. Oral, fecal. Hepatitis A is transmitted via oral, fecal route. Infectious food handlers may contaminate non-cooked foods, and it can also occur through ingestion of contaminated food or water. 23. The patient's pulse was 88 bpm. What will you tell the patient? A. Your pulse is normal. B. Your pulse is fast. C. Your pulse is abnormal. D. Your pulse is slow. Correct answer: your pulse is normal. The normal pulse is 60 to 100 beats per minute. This patient has a pulse rate of 88, therefore, you should tell the patient that the pulse is normal. 24. A 38-year-old man was rushed to the hospital because of bloody diarrhea. The doctor said that the cause can be a single-celled organism. Which organism is he referring to? A. Lyme. B. Amoeba. C. Salmonella. D. Trichomonas. Correct answer, B. Amoeba. Amoeba is a parasite classified under protozoa. They are single-celled organisms found in contaminated water that can cause dysentery, inflammation of the intestines causing diarrhea with blood. 25. A patient weighs 200 pounds. How much does he weigh in kilograms? A. 100 kilograms. B. 90 kilograms. C. 80 kilograms. D. 200 kilograms. Correct answer, B. 90 kilograms. The conversion factor from pounds to kilograms is 0.45. To find out how many kilograms in a pound, multiply the number of pounds by the factor, 0.45. The patient weighs 90 kilograms. 26. Which of the following diseases is not caused by a virus? A. Chickenpox. B. Herpes. C. Tuberculosis. D. Measles. Correct answer, C. Tuberculosis. Tuberculosis, TB, is caused by the bacteria Mycobacterium tuberculosis. Chickenpox, herpes, and measles are diseases caused by viruses. 27. A patient who weighs 100 kilograms will be how heavy in pounds? A. 220 pounds. B. 45 pounds. C. 100 pounds. D. 300 pounds. Correct answer, 220 pounds. The kilograms to pounds weight conversion factor is 2.2. 1 kilogram is equivalent to 2.2 pounds. To get the pounds, you have to multiply the kilograms by 2.2. The patient will be 220 pounds, 28. A 18-year-old who went camping for 1 week was seen at the office because of fever, headache, fatigue, and a characteristic skin rash called erythema migrans. The classic skin rash is characteristic of what disease? A. Lyme disease. B. West Nile. C. Gonorrhea. D. HIV. Correct answer, Lyme disease. Lyme disease is caused by the bacteria Borrelia burgdorferi. It is transmitted through the bite of an infected tick. Symptoms include fever, headache, fatigue, and a characteristic skin rash called erythema migrans. 29. The blood pressure of the patient is 120/80 mmHg. Based on this, what is the pulse pressure of the patient? A. 10 mm of mercury. B. 20 mm of mercury. C. 30 mm of mercury. D. 40 mm of mercury. Correct answer, D. 40 mm of mercury. Pulse pressure is the difference between the systolic and diastolic pressures. By subtracting 80 from 120, the pulse pressure will be 40 mm of mercury. 30. Which attributes should the physician consider in hiring a medical assistant? A. Dependent. B. Initiative. C. Incompetent. D. Indolent. Correct answer, B. Initiative. Physicians look for medical assistants that have initiative. Initiative is the ability to do something before being told. Medical assistants who have this trait are independent and do not need to be given directions all the time. 31. If a medical assistant stops a patient from leaving the clinic against her will, and without medical or legal justification, the patient can accuse the medical assistant of A. Harassment. B. Invasion of privacy. C. Fraud. D. False imprisonment. Correct answer, D. False imprisonment. False imprisonment involves intentionally restricting another person's freedom of movement. It is the unlawful restraint of another, against their will, and without medical or legal justification. 32. Charging patients for medical procedures and treatments that were actually not performed is A. Negligence. B. Embezzlement. C. Felony. D. Fraud. Correct answer, D. Fraud. Fraud is the intentional deception of a person or entity by another made for monetary or personal gain. In this case, fraud is through falsification of billing claims to get reimbursements from the state or federal government. 33. An area of study that deals with ideas about what is good and bad behavior, law. B. Ethics. C. Tort. D. Malfeasance. Correct answer, B. Ethics. Ethics is an area of study that deals with ideas about what is good and bad behavior. Medical ethics helps to improve patient care and public health by promoting professionalism. 34. The Latin phrase, quid pro quo, refers to something for something. B. Captain of the ship. C. The evidence speaks for itself. D. Malpractice. Correct answer, something for something. Quid pro quo is a Latin phrase that means something for something. The phrase usually indicates an exchange of goods or services of roughly equivalent value. 35. Laws that are intended to reduce bystanders' hesitation to assist, for fear of being sued or prosecuted for unintentional injury or wrongful death, is state law. B. Uniform Commercial Code, UCC. C. Good Samaritan Law. D. Constitutional law. Correct answer, C. Good Samaritan law. Good Samaritan laws are laws or acts protecting those who choose to serve to others who are injured or ill. They are intended to reduce bystanders' hesitation to assist, for fear of being sued or prosecuted for unintentional injury or wrongful death. 36. The highest law of the United States, A. International law. B. Public law. C. Supreme Court law. D. U.S. Constitution. Correct answer, D. U.S. Constitution. The U.S. Constitution is the highest law in the land. It is the foundation on which all laws have been built. Constitutional law defines the relationship of the executive, the legislature, and the judiciary. 37. Not stopping for a stop sign is A. Misdemeanor. B. Felony. C. Summary offense or infraction. D. Penalty. Correct answer, C. Summary offense or infraction. An summary offense or infraction is a violation of a law or ordinance that usually results in a fine. Not stopping for a stop sign is an example of a summary offense or traffic infraction. 38. Patients who have died, moved away or terminated relationship with the practice are classified as A. Inactive. B. Closed. C. Active. D. Nuisance. Correct answer, B. Closed. Records of patients who have died, moved away or terminated relationships with the practice are classified as closed. Patients who are currently receiving treatment are classified as active, and patients who have not been managed within 6 months or longer are classified as inactive. 39. Which of the following types of filing cabinets maximize the use of space? A. Vertical. B. Lateral open shelf. C. Lateral drawer. D. Rotary. Correct answer, D. Rotary. A rotary or movable lateral file cabinet is an electronically or manually powered file cabinet that rotates files in position to be accessed. It maximizes the use of space and holds large volumes of records. 40. Which is the most confidential filing system? A. Alphabetical filing. B. Numerical filing. C. Subject filing. D. Color filing. Correct answer, B. Numerical filing. In the numerical filing system, patient files are given numbers and arranged in a numerical system. It is the most confidential system, and expansion is unlimited. 41. What is the advantage of using color-coded labels? A. Misfiled records are easy to see. B. It is most frequently used in research. C. Only the staff knows the color codes. D. No need to add additional labels. Correct answer: misfiled records are easy to see. The advantages of color-coded systems is that files can be retrieved faster and misfiled records are easy to see. It consists of labels that indicate a number, letter, or alphanumeric character. Subject files can also be color-coded. 42. What type of muscle tissue is cardiac muscle? A. Striated and voluntary. B. Striated and involuntary. C. Smooth and voluntary. D. Smooth and involuntary. Correct answer: B. Striated and involuntary. Cardiac muscle is both striated and involuntary muscle tissues. Skeletal muscles are both striated and voluntary, and internal organs are composed of smooth and involuntary muscles. 43. Which of the following correctly spells the suffix for discharge or flow? A. Ria. B. Ria. C. Ria. D. Raya. Correct answer: F. Ria. The correct spelling for the suffix meaning discharge or flow is Ria. All the other choices are spelled incorrectly. 44. The following are true statements about the heart, except the heart is located in between the lungs called mediastinum. B. It exhibits the property of contractility. C. The left side pumps blood to the lungs for oxygenation. D. The right side of the heart pumps blood to the pulmonary artery for oxygenation. Correct answer: C. The left side pumps blood to the lungs for oxygenation. The left side of the heart pumps does not pump blood to the lungs for oxygenation. It pumps oxygenated blood to the rest of the organs. The right side of the heart pumps blood to the lung for oxygenation. 45. If the patient complains of missed menstruation, the medical term for that is menorrhagia. B. Amenorrhea. C. Menarche. D. Menopause. Correct answer: B. Amenorrhea. Amenorrhea is the term for missed menstruation. The prefix a refers to without, meno refers to menstruation, and rhea refers to flow. 46. Fine motor skills and coordination are controlled by medulla oblongata. B. Frontal lobe. C. Cerebellum. D. Hypothalamus. Correct answer: C. Cerebellum. The cerebellum controls fine motor skills, balance, and coordination. The rest of the choices are not involved in coordination and fine motor skills. 47. The medical term for fungal infection of the nail is A. Onychomycosis. B. Onycholysis. C. Meioses. D. Trichosis. Correct answer: A. Onychomycosis. Onychomycosis is fungal infection of the nail. Onycho is the root word for nail, myco is the term for fungus, and osis is the suffix for abnormal conditions. 48. Breathing is controlled by what part of the brain? A. Hypothalamus. B. Cerebellum. C. Pons. D. Medulla oblongata. Correct answer: D. Medulla oblongata. The medulla oblongata is the control center for involuntary respiration. When carbon dioxide builds up in the blood, a message is sent to the medulla. This will trigger an involuntary respiration. 49. A physician who specializes in the study of the urinary system, urinologist. B. Anesthesiologist. C. Urologist. D. Enterologist. Correct answer: C. Urologist. A urologist is a physician with specialized training in the urinary system of both males and females, but also has specialized training of the male reproductive system. 50. Which of the following cells release histamine? A. Monocytes. B. Basophils. C. Leukocytes. D. Lymphocytes. Correct answer, B. Basophils. Basophil releases histamine. These are active in allergic reactions. 51. What occurs when an Rh woman is pregnant with an Rh plus fetus, and the RBCs of the fetus are destroyed by Rh antibodies produced by the mother? A. Humoral immunity. B. Hemolytic disease of the newborn. C. Cell-mediated immunity. D. Diarthroses. Correct answer, B. Hemolytic disease of the newborn. Correct blood typing is important not only for blood transfusion, but also for identifying women who could put their infants at risk for hemolytic disease of the newborn, HDN. This is also called erythroblastosis fetalis. 52. The middle section of the small intestine is A. Duodenum. B. Fundus. C. Ileum. D. Jejunum. Correct answer, D. Jejunum. Jejunum is the middle section of the small intestine. The small intestine has 3 sections. The first section is the duodenum, the second section is the jejunum, and the third section is the ileum. 53. How do you know if the EKG machine is calibrated? A. It produces a calibration mark of 10 mm high. B. It produces a calibration mark of 10 mm wide. C. It produces a calibration mark of 15 mm high. D. It produces a calibration mark of 15 mm wide. Correct answer, A. It produces a calibration mark of 10 mm high. The ECG machines require calibration to ensure accuracy. The ECG machine has a auto-calibrate feature in which the EKG machine prints a calibration mark as a square wave that is 10 mm high, 2 mm wide. 54. A. Medical assistant is performing ECG. Where should the V3 electrode be placed? A. 4th ICS left sterno border. B. Midway between V2 and V4. C. 5th intercostal space right sterno border. D. Right bicep. Correct answer, B. Midway between V2 and V4. Electrode V3 is placed between V2 and V4. Electrode V2 is placed on 4th ICS left sterno border, and V4 is placed on the 5th ICS mid-clavicular line. 55. What does lead I on the ECP strip represent? A. Represents the electricity from right arm to left arm, or ALA. B. Represents the electricity from right arm to left leg, or ALO. C. Represents the electricity from left arm to left leg, LALO. D. Represents the electricity from right leg to left leg, RLO. Correct answer, A. Represents the electricity from right arm to left arm, RALA. Lead I represents the electricity from right arm to left arm, or ALA. Lead 2 represents the electricity from right arm to left leg, RALO, and lead 3 represents the electricity from left arm to left leg, LALO. 56. How would you know that the ECG cable is the right arm, or IT, cable based on its color? A. It is colored red. B. It is colored black. C. It is colored green. D. It is colored white. Correct answer, D. It is colored white. The following are colors of the ECG cables: R white, L black, RL green, and LL red. These colors are for the limb cables. 57. How will you make sure that the electrodes will adhere to the skin of the patient? A. Open a brand new electrode package. B. Warm your hands. C. Apply alcohol to the placement sites. D. Apply the cables before placing the electrodes on the skin of patient. Correct answer, C. Apply alcohol to the placement sites. Proper placement of electrodes requires cleaning the sites with alcohol to remove oils, dirt, and substances on the skin. This will prevent the electrodes from falling from the skin throughout the duration of the procedure. 58. if the patient is suspected to be colorblind, which test should the medical assistant prepare the patient for? A. Snellen. B. E-chart. C. Ishihara. D. Jaeger. Correct answer, C. Ishihara. Ishihara test is a test for colorblindness. Patients are asked to distinguish numbers printed on a background of colored spots. 59. If the patient complains of blurry vision, which of the following will the doctor use to determine visual acuity? A. Snellen. B. E-chart. C. Landolt. C. D. All of the above. Correct answer, D. All of the above. All can be used. Snellen E-chart and Landolt C charts are charts used to check for visual acuity. 60. A 56-year-old patient was seen in the clinic coughing with blood. An X-ray was done which showed a mass in the hilar area of the lungs. Which of the following will be the next step of the doctor? A. Thoracentesis. B. Bronchoscopy. C. Spirometry. D. Thoracotomy. Correct answer, B. Bronchoscopy. A mass in the hilar area is suggestive of lung cancer. To determine if the mass is cancerous or benign, the physician would most likely do a bronchoscopy to visualize the bronchi and perform a biopsy if a mass is accessible. 61. What is the unit of measurement of the clock speed of a computer's microprocessor? A. Bits. B. Bytes. C. Volts. D. Megahertz. Correct answer, D. Megahertz. Clock speed is measured in megahertz, megahertz. 1 megahertz equals 1 million cycles per second. 62. What is the function of the tab key? A. Deletes the character before the cursor. B. Moves the cursor one space forward. C. Moves the cursor to the beginning of the next line. D. Moves the cursor several spaces forward. Correct answer, D. Moves the cursor several spaces forward. The tab key moves the cursor several spaces forward. The tab key refers to the tabular key. 63. Which of the following devices allow the user to manipulate the cursor? A. Tab key. B. Backspace. C. Bluetooth. D. Mouse. Correct answer, D. Mouse. The mouse is a pointing device to manipulate the cursor. It also allows the user to interact with the items on the display screen. 64. The most common keyboard layout is A. Dvorak. B. QWERTY. C. Azerty. D. Maltran. Correct answer, B. QWERTY. QWERTY layout is the most common keyboard layout in the English language. The name QWERTY was derived from the first 6 letters on the keyboard on the top left. 65. A paper or electronic document in which data is arranged in rows and columns, and is commonly used for calculations in business operations. A. Database. B. Word processor. C. Spreadsheet. D. Tabulator. Correct answer, C. Spreadsheet. A spreadsheet is a table of data arranged in rows and columns. Businesses use spreadsheets to present actual and projected data, for presentations and planning. 66. Which keyboard key, when pressed, shows the help window for a program? A. F1. B. Escape. C. F10. D. Enter. Correct answer, A. F1. The F1 key shows the help window for a program. Function keys can be programmed to perform specific functions. 67. The keyboard key that enters and exits the full screen mode. A. F9. B. F10. C. F11. D. F12. Correct answer, C. F11. The F11 key enters and exits the full screen mode. Function keys are abbreviated on the keyboard as F1 to F12. Function keys can be combined with the Alt or Control key for special functions. 68. What is the greeting we use at the beginning of a letter, email, or a memo? A. Heading. B. Salutation. C. Complimentary. D. Closing. Correct answer, B. Salutation. The greeting we use at the beginning of a letter, email, or a memo is referred to as the salutation. Most salutations begin with a "Dear." 69. All of the following are types of printers, except A. Inkjet. B. LCD. C. Laser. D. Multifunctional. Correct answer, B. LCD. LCD or liquid crystal clear is a flat panel video display used in monitors, not printers. Laser, inkjet, and multifunctional are types of computer printers currently in the market today. 70. The nutrient that builds and repairs body tissues. A. Glucose. B. Vitamins. C. Proteins. D. Minerals. Correct answer, C. Proteins. Proteins are nutrients composed of amino acids as building blocks. Proteins build and repair body tissues, and produce 4 calories per gram. 71. Which of the following is not considered a mineral? A. Iodine. B. Riboflavin. C. Magnesium. D. Zinc. Correct answer, B. Riboflavin. Riboflavin is the common name of vitamin B2. It is a vitamin, not a mineral. Iodine, magnesium, and zinc are all minerals. 72. An early childhood disease caused by deficiency in calcium, vitamin D, and phosphate. A. Hallux valgus. B. Osteomalacia. C. Rickets. D. Kyphosis. Correct answer, C. Rickets. Rickets is a disease that results in bone deformities, especially in the legs, causing them to bow. Symptoms can include pain and tenderness of the bones and increased likelihood of fracture, impaired growth, decreased height, and also muscle cramps. 73. What is the most common cause of hepatitis? A. Syphilis. B. Drugs. C. The human immunodeficiency virus. D. Viruses. Correct answer, D. Viruses. Viruses would be the most common cause of hepatitis. 74. Mr. Phillips comes to your clinic with his 4-year-old son. The child has been telling his parents that his ears hurt and he has not felt well for a few days. What is most likely to be his diagnosis? A. Otitis externa. B. Ishihara disease. C. Tinnitus. D. Otitis media. Correct answer, D. Otitis media. Inflammation of the middle ear, or otitis media, is common in children due to the position of the eustachian tubes during growth. This condition is commonly associated with the presence of fluid in the middle ear. 75. Mr. Martinez is a 75-year-old male patient who has been diagnosed with hardening of the arteries. What term will the physician use in the documentation? A. Arteriosclerosis. B. Aneurysm. C. Varicose veins. D. Atherosclerosis. Correct answer, A. Arteriosclerosis. Arteriosclerosis is commonly called hardening of the arteries. Actually, this means that the arteries lose their elasticity and the arterial walls have become weak as people age. 76. A 47-year-old chronic alcoholic male was admitted because he is not oriented to time and place. He also has memory loss, unsteady gait, and numbness. Which vitamin is most likely the culprit? A. Vitamin A. B. Vitamin D. C. Vitamin B1. D. Vitamin K. Correct answer, C. Vitamin B1. This is a case of Wernicke-Korsakoff syndrome that occurs commonly among chronic alcoholics. The poor diet of chronic alcoholics leads to vitamin B1 deficiency. Thiamine is the name of vitamin B1. 77. A 25-year-old vegan patient was brought to the clinic because of fatigue. The patient was diagnosed with anemia. Which of the following vitamin deficiencies can cause this disease? A. Vitamin B1. B. Vitamin B6. C. Vitamin B12. D. Vitamin B3. Correct answer: C. Vitamin B12. Vitamin B12 deficiency can lead to vitamin B12 deficiency anemia. Known causes of vitamin B12 deficiency include Crohn's diseases, heavy drinking, and a vegan diet. 78. Some drugs come from a plant source. An example of one of these drugs would be A. Humulin. B. NSAIDs. C. Demerol. D. Codeine. Correct answer: D. Codeine. Drugs from plant sources include codeine, morphine, and paregoric. These are derived from the opium poppy plant. Plants, minerals, animal proteins, synthetics, and semi-synthetics are some of the drugs that come from many sources. 79. In terms of the administration of medication, what does contraindication mean? A. A condition in which a drug should never be used. B. The interaction between two drugs that work together. C. Anaphylaxis. D. Cumulative effect. Correct answer: A. A condition in which a drug should never be used. A condition in which a drug should never be used. An example is when certain drugs are contraindicated in patients who are pregnant if the medication could cause birth defects. 80. Any refrigerator or freezer used for vaccine storage must be a special unit inspected by the National Vaccine Center every year. B. Be located in a locked room with no heater vents. C. Be dedicated to the storage of only vaccines and medications. D. Ensure the maintenance of the cold chain. Correct answer: C. Be dedicated to the storage of only vaccines and medications. A refrigerator or freezer must be dedicated to the storage of only vaccines or medications. It must be able to maintain required vaccine storage temperatures year-round and have a certified calibrated thermometer inside at all times and checked daily. Do not store food or beverages in the same unit as vaccines and medications. 81. A 5-year-old boy has an ear infection. He has fever and otalgia. To address his fever, the recommended medication is A. Antibiotic. B. Antipyretic. C. Anesthetic. D. Antianginal. Correct answer: B. Antipyretic. Antipyretic medications reduce body temperature. Pyrexia is the medical term for raised temperature. 82. The nurse is contemplating if she would request an oral medication or parenteral medication from the physician. What is a disadvantage of the oral route? A. It is easily taken by the patient. B. It is not the fastest absorption route into the bloodstream. C. It is considered safest because medications can be retrieved more easily than other routes. D. It does not require special devices or equipment. Correct answer: B. It is not the fastest absorption route into the bloodstream. The oral route is not the fastest way to absorb medications to the bloodstream. The fastest route is the intravenous route. 83. Some medications have special coating to protect them from the acidity of the stomach and that allows them to pass the small intestines for absorption. This is referred to as slow-release coated medications. B. Double-coated medications. C. Enteric-coated medications. D. Rapid-response medications. Correct answer: C. Enteric-coated medications. Enteric-coated medications have special coating to protect them from the acidity of the stomach and that allows them to pass the small intestines for absorption. The term enteric refers to the small intestines. 84. A lotion is an example of what type of drug? Administration. A. parenteral. B. Intradermal. C. Topical. D. Enteral. Correct answer, C. Topical. Topical medications are applied to the epidermis and mucous membranes. Some examples of topical medications are creams, lotions, ointments and patches. 85. A patient was diagnosed with pneumonia and is coughing continuously. The doctor advised the patient to take Robitussin. What is the classification of Robitussin? A. Antitussive. B. Anti-inflammatory. C. Antibiotic. D. Analgesic. Correct answer, A. Antitussive. Robitussin is classified as an antitussive. Antitussives decrease the cough reflex. 86. The mother of an 8-year-old gave her son calamine lotion because he was complaining of itchiness. This medication is classified as A. Adrenergic. B. Antiemetic. C. Analgesic. D. Antipyretic. Correct answer, D. Antipyretic. Antipyretics relieve itching. It is used for skin disorders and allergies. Medications that are antipyretics are calamine lotion and hydrocortisone. 87. What is the recommended immunization for a baby who was just born? A. Hepatitis B, flu shot. C. Measles. D. Pertussis. Correct answer, A. Hepatitis B. The recommended immunization schedule for a newborn is to administer hepatitis vaccine, Hep B, to all newborns prior to hospital discharge. The second dose should be administered at age 1 to 2 months. 88. The generic name of both Advil and Motrin is A. Acetaminophen. B. Naproxen. C. Ibuprofen. D. Amoxicillin. Correct answer, C. Ibuprofen. Ibuprofen is the generic name of both Advil and Motrin. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID. It works by reducing hormones that cause inflammation and pain in the body. 89. A patient was diagnosed with high cholesterol during blood testing. Which of the following drugs is recommended for his condition? A. Prednisone. B. Xanax. C. Ambien. D. Lipitor. Correct answer, D. Lipitor. Lipitor is a prescription medicine called statins. They lower cholesterol in the blood, specifically LDL or the bad cholesterol, and triglycerides. It can raise the HDL, good cholesterol, as well. 90. A 28-year-old complains of insomnia after breaking up with her boyfriend of 10 years. She requested a sleeping pill. Which of the following is recommended for her? A. Nexium. B. Amoxil. C. Ambien. D. Allegra. Correct answer, C. Ambien. Ambien is a sedative hypnotic drug. It works by slowing activity in the brain, and is used to treat insomnia. The generic name of Ambien is sulpidem tartrate. 91. According to Jean Piaget, once children acquire language, they are able to use symbols such as words or pictures to represent objects. Which stage of cognitive development is this? A. Sensorimotor. B. Preoperational. C. Concrete operational. D. Formal operational. Correct answer, B. Preoperational. Preoperational stage is when children begin to think symbolically and learn to use words and pictures to represent objects. They also tend to be very egocentric, and see things only from their point of view. 92. A nurse says to a patient, "Just so I understand, you said that." This type of communication is A. Restating. B. Reflecting. C. Focusing. D. Probing. Correct answer, F. Restating. Restating is to state something again or in a different way. It lets the patient know how the message was interpreted by the health provider. 93. Which of the following best describes Kubler-Ross's stages of grief? A. Denial is the first stage of grief that patients experience. B. All patients go through the same stages of grief. C. Depression is the last stage of grief that patients experience. D. Each dying patient and their family members have individual experiences. Correct answer: D. Each dying patient and their family members have individual experiences. It is important to remember that each dying patient and his or her family members have individual experiences. There is no set period of time for any stage of grief, and patients and their family members may go through the stages differently. Patients, as well as family members, can move back and forth between the stages or stay in one stage until death. 94. A husband gets really angry at his wife but accuses her of being mad at him. This defense mechanism is A. Denial, B. Splitting, C. Projection, D. Reaction formation. Correct answer: C. Projection. Projection is a defense mechanism that involves taking our own unacceptable thoughts or feelings and assigning them to other people. Sometimes we don't want to acknowledge the truth about ourselves, and so we turn it around and put it on others. 95. When dealing with a hearing-impaired patient, which of the following is not a recommended strategy? A. Eliminate as much background noise as possible. B. Touch the patient's arm or shoulder gently to get the patient's attention. C. Speak in a normal tone. D. Use visual aids as appropriate. Correct answer: C. Speak in a normal tone. Since the patient has hearing impairment, it is recommended to increase your voice volume, but refrain from shouting. Background noise should be also eliminated. Touching the patient's arm to get the patient's attention and using visual aids are all recommended strategies. 96. Establishing a matrix in the appointment book refers to blocking out the times when the health provider is unavailable. B. Blocking out the times when patients are unavailable. C. Blocking out the times when the nurse is not available. D. Blocking out the times if the facility is unavailable. Correct answer: blocking out the times when the health provider is unavailable. Establishing a matrix is to block out the times when the health provider is unavailable for appointments. It takes into consideration appointment intervals and break times such as lunch, meetings, and rounds. 97. All of the following are steps in the hiring process, except checking references. B. Supervision. C. An offer. D. Recruiting. Correct answer: B. Supervision. Supervision is part of management practice, not a hiring process. Recruitment. Interviewing, checking references, selection, negotiation, and offer and acceptance are employed in the hiring process. 98. When an appointment is cancelled by a patient, the medical assistant should A. Educate the patient. B. Tell the patient the doctor will call for a rescheduling. C. Document the cancellation and contact the patient for rescheduling. D. Wait for the patient to reschedule. Correct answer: C. Document the cancellation and contact the patient for rescheduling. The proper procedure when a patient cancels or does not show up is to call the patient for rescheduling and document the missed appointment. 99. A performance appraisal can be based on the following, except teamwork. B. Ethnicity. C. Dependability. D. Attitude. Correct answer: B. Ethnicity. A performance appraisal assesses an employee's performance objectively. These can be according to the employee's work ethics, teamwork, and attitude. Ethnicity is not a way of assessing employee performance. 100. Office equipment inventory and maintenance requires keeping records on which the following: warranties. B. Model and serial number. C. Date of purchase. D. All of the above. E. Both A and C only. Correct answer: D. All of the above. Office equipment are expensive assets. After years of use, they break down. To prevent problems with manufacturers, warranties, service agreements, date of purchase and model and serial number of the item should be kept. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.